Today I have two hats on. I'm Joyce Davis. I'm Director of Communications for the City of Harrisburg, as well as President and CEO of the World Affairs Council of Harrisburg. And I'd like to say that the World Affairs Council of Harrisburg is proud to have been a supporter of this important study, as well as in disseminating its results to the community. But I also want to bring you greetings from Mayor Eric Pappenfuss, who was unable to be here as much as he wanted to, but very much supports this kind of work so that we are able to better support our community. He has a conflicting engagement, but we are planning to put the results of this report on the city's website and to continue to engage people in how we can better embrace the Latino community and assist with these kinds of health issues. So without any further ado, I'd like to invite Senator Rob Teplitz to come, who will offer his own remarks about this important study. Senator Teplitz.
Thank you. Good morning. I'm Rob Teplitz. I have the honor of representing the 15th District, which is the city of Harrisburg, where we're at now, most of Dauphin County, and all of Perry County. I'm here today to help release this report that is so important. What brought me here was cancer touching my own life, as it has touched most Pennsylvanians and most Americans' lives. I grew up around here. I went away to college and law school, came back after law school. Within about a month, received a phone call from the family of one of my closest friends from college that he was dying of a very rare form of stomach cancer that had just surfaced, and they just found it, and it would take his life, and it did take his life within the next month. And in figuring out how to deal with that as a young person, I found my way to the American Cancer Society, the Capital Region Unit here in Harrisburg, and became a volunteer, eventually chaired the Daffodil Days fundraiser that they do every year, went on the board, and was able to work with those good folks on advocacy and research and prevention. Here in the state Senate, I've tried to be an advocate for policies that will help support your efforts, the efforts that we're talking about today. One of the first things that I was able to do, and this credit deserves to go to Governor Corbett, was when he nominated Dr. Aralia to the Pennsylvania Cancer Control Board, my constituent. We got to know each other, and I was very pleased to help support that confirmation. She opened my eyes up to the importance of the board, and more recently, the fact that the board tenure was going to expire this year. So we were able to insert into the fiscal code that passed along with the budget an extension of 10 years so that the board can continue to do its work. We also were able to pass into law Act 66 of 2015, which creates a prostate cancer task force to deal with that issue and advise the Department of Health and the governor on what we should be doing for that particular form of cancer. But what is very important in the world of treating this terrible menace is data, because without data, especially data relating to underserved and minority populations, we can't know what the most effective ways to treat and prevent and research might be. That's why this report is so important, and I very much appreciate being invited to help release the report. And I look forward to doing whatever I can once the report is released and we can digest it to figure out how to match that up with public policy to implement the recommendations and make sure that the Latino population and other populations that are historically underserved in our community have the same advantages as any other population, that we can make sure that everyone can live in a cancer-free world. So thank you for having me here, and I look forward to hearing about the report.
Thank you very much, Senator Teplitz. And yes, we are here to hear directly from the authors of what is the first Latino Hispanic Cancer Burden Report, and to give us some insights into exactly what are the issues, what are potentially the causes that would perhaps lead to some solutions. So with that, I would like to invite first Dr. Eugene Lingerich, one of the authors of the report, to come forward and to offer some, I guess, a little bit of data or insights. Please.
Thank you, Joyce. Thanks for the introduction, and thank Mayor Papenfuss for this as well, and particularly for being willing to host the report on the city's website. We really appreciate that, because this is not something that should be locked up in a room collecting dust. We don't want that to happen. In fact, maybe the most important this is what this can be a springboard for some other efforts, and we're really looking forward to that. And Senator Teplitz, thank you also for your support in getting this moving forward, and also for helping to get Dr. Aralia appointed to the Cancer Advisory Board. That's a big plus for the state of Pennsylvania. As Joyce said, my name is Gene Lengrich. I am the Associate Director for Health Disparities and Engagement of the Penn State Cancer Institute. This is part of Penn State University as well as the Penn State Health System. We are a comprehensive cancer center here in central Pennsylvania, and we take our charge very seriously to provide cancer prevention and control and treatment to people of central Pennsylvania, and we're very diligent about making that happen. We do that through care, as you would see at our hospital, but we also do that through other efforts, such as through primary care and community education. We ground our work in data, and it's really important that this report come out at this point in time, because the Latino population in Pennsylvania is strong, and it's growing even stronger. As the report says, we expect that there to be about 1 million people by Hispanic Latino origin in Pennsylvania by the year 2020. That would be about 8 to 9% of the population of Pennsylvania, and it's growing dramatically. As the report states, some of the counties in Pennsylvania are increasing dramatically in the Latino population. All of them since 1990 have doubled at least, and some have gone up by 6- and 7-fold increase. So this increase in that population is extremely, extremely important. There is a lot of data in this report, and it's going to drive a lot of future efforts. So what I want to do is just highlight a couple of things that are in the report, and then turn it over to Dr. Dominic, who will tell you more about it. But first of all, cancer among Latinos and Hispanics in Pennsylvania is an extremely important event. It is one that is taking way too many lives. Similar to many of the other populations, the cancer sites that lead this population for women is breast cancer, lung cancer, and colon cancer. All of these have significant ways to prevent or to reduce the burden of those. And part of our message here in getting this out is that women of Latino and Hispanic origin should be availing themselves of the preventive services or taking measures to modify behaviors or risks that would increase that. And I'm really delighted that Senator Teplitz emphasize the issue of policy, because that's incredibly important in cancer prevention and control. This is not just an issue of an individual's behavior or a medical system's care that's provided, but it's also the environment and the policy within which we live. We've made great strides in places like tobacco control, and we're very proud of that, and the Latino population has benefited from that as well, because the lung cancer rates, though they're still very high, are going down. For men, similarly, the leading cancers in the report are of lung cancer, colon cancer, and prostate cancer. And these also have significant preventive efforts available to them. And what we hope that this is a springboard, again, to get this message out to individuals that these can be prevented. Now, specifically to the Latino and Hispanic population in Pennsylvania, and what the report talks about, one cancer that it calls attention to, even though it's not one of the highest three that I just spoke about, is liver cancer. Liver cancer is high in Pennsylvania, Pennsylvanians, Latinos, and Hispanics, as it is throughout the country, and it's something that we all need to take into stock. And there is a vaccine, hepatitis B, which can be taken to reduce the risk of liver cancer. So there are measures even for this cancer that is striking the Latino and Hispanic population so strongly. Another cancer that is more frequent among the Latino and Hispanic population is cervical cancer. And cervical cancer is one cancer that we really should be able to eliminate for women, particularly through the HPV vaccine of younger populations, particularly starting at 11 and 12-year-old for both boys and girls. It's approved and recommended now by pediatricians, by family physicians, by most of the healthcare community. So for those who are parents or teachers or nurses of adolescents in that age, the HPV vaccine is recommended and should be one that should be had and will greatly reduce the risk of cervical cancer for women in the future. It also helps prevent some of the cancers among men, particularly oral pharynx cancer as well as penile cancer. So it's very important both for men and for women. But those two cancers are two cancers that typically strike the Latino and Hispanic population at a greater rate, and there are preventive measures for both of those. So what I see this report as being is a launching pad for us to get on the stick and to be able to ramp up our prevention efforts, working with primary care, with hospitals, with the community-based organizations such as the American Cancer Society and the other community-based organizations in the state. I'm really pleased to be here. Unfortunately, Dr. Hull, who is our director of our Cancer Institute, was not able to be here. He's in Indianapolis with a Big Ten Cancer Research Symposium today, so I'm pleased to be here to represent this. But the Cancer Institute of Penn State takes cancer prevention and control among all populations extremely seriously, and we're really delighted to be a part of this report. Thank you.
Thank you. I don't think it can be stressed enough how important this report is for our region. In La Voz Latina, there's a summary here that you can look at, but this report was sponsored by a grant from the National Institutes of Health, the National Cancer Institute, the Center to Reduce Cancer Health Disparities, with technical support from the Community Service and Health Outcomes, as well as the Community Penn State Cancer Institute and the Appalachia Community Cancer Network. So a lot of institutes saw this as an important need for us so that we have data and can really identify what is going on in our Latino population. That impacts all of the rest of us as well. And so to give us a little bit more information about this, I would now like to call up a member of the board of the World Affairs Council of Harrisburg, as well as an employee of Highmark, but Dr. Oralia Garcia Dominique, so she can offer some further insight.
Good afternoon, and thank you so much for being here. My name is Oralia Garcia Dominique, and I would like to thank you, our community. As I look out today, I see representation of the shakers and the movers of the Commonwealth of Pennsylvania. I see dynamic leadership on the front line, being the first responders for cancer prevention, treatment, and control. I'd like to identify that all of us are on the same mission, and that is to stop cancer. I also want to identify that cancer efforts are not done in isolation. There are 4 pillars. Everyone makes reference to 3 pillars, but there are 4. There is you and the family that you represent. The second is the legislation that's needed and the policy to allow us to have access to quality health care, to have access to screening, and to have access to prevention data that allow us to say, number 1, can it be prevented? And if so, how? And the next level then would be who would be able to be at the front lines to defend us against cancer. The second pillar is not, first is you, the second is legislation and dynamic leaders, including Senator Teplitz, who allowed the efforts even for the CAB board to continue for another 10 years. But the you is who you represent, your community. I see here to my left from Estados Unidos of Pennsylvania, America, a grassroots organization. I see the Harrisburg School District and the first Latina who is a principal for both STEM, which is science, technology, education, as well as math emphasis to address the workforce shortage that we need to address cancer, Marisol Craig. I also see Professor Maria Diaz, who is not only allowing us to increase our ability to translate and to even converse in more than one language. She is a Spanish professor, and the doctor-patient relationship and that communication is highly impacted by professors like Maria Diaz. I also see our community that is championing equity for all. And two individuals, though, we are here to launch Hispanic Heritage Month. But you can see among you, there is a diverse group of individuals here that say, I want health equity for all. And I thank also the Department of Health and David Saunders, who's the new director of the Office of Health Equity, again, championing for cancer prevention and other chronic health conditions that are priority health concerns. I also thank Rosemary Brown, who is the CEO of Alder, who again, treats our community with dignity and high quality of access for all. I also thank Barbara Jackson, who is the founder of Catalyst, another organization for cancer prevention and control and treatment, and Eartha, who is also the champion in another pillar. And I also thank the individuals who are the leaders for cancer prevention, treatment, and control for the entire state. They are our first line responders. They are the individuals that produce data, and not just today, but they have done it historically. And that, again, is for the leadership under the CAB, which is the Cancer Advisory Board. And Sharon, we must acknowledge you since you lead those efforts and allow us to pair up with national standards and our collaboration with the Center for Disease Control. Our efforts here are wonderful, but they really don't materialize or have an impact without the support, both grassroots support as well as legislative support, as well as content expert support, and more importantly, the Center for Disease Control. That is allowing Pennsylvania to be a model for other states to follow. So I thank you for that. For our faith-based leaders, I see Reverend and Dr. Joe Green. I thank you for that from the USDA, and our Latino superstar in outreach, both in faith-based organizations. I see Noel Soto there as well. In terms of our media, we also thank each and every one of you for allowing this event to be a discussion for the Commonwealth and for the nation, and for you to be here. We thank you to Jim for La Voz as well, and one of the founders, Esmeralda Hetrick, we thank you as well. Dr. Hector Ortiz, we also thank you for your efforts, and Janine for your effort, Dave Botero, and as well as every single one of you that is represented here, either yourself, your family, or your community. I will now like to just share a little bit about the need for cancer. Dr. Cambick is a local primary care physician whom I had teamed up to bring cancer screening to the community in the Commonwealth. He was very instrumental in Dauphin County, and the model that we designed together but then was exported into 8 counties. We had one mission, that's to stop colorectal cancer. In that project that was funded by the National Institutes of Health, we then quickly realized that there were data that allowed us to know what the prevalence is and the mortality. So who gets it? New cases, and who dies from it. But we were interested in preventing it, and also knowing, do you have a higher risk? And does this risk make any difference? Does it increase? Does it lower? Does it remain the same? Should you live in Dauphin County? Should you live in Allegheny County? Should you live in Bedford County? We examined the entire 67 counties. We were also wanted to know if indeed it made a difference if you were male or female. If it made a difference if you lived in a rural or in an urban setting, and in a federally qualified rural Appalachia setting. So what does that mean? That means that I have many questions and not too many answers. So thus I said, well, we will turn to the Department of Health and look at these state-level data. And they do a phenomenal job. If you have not visited the Department of Health, please visit Health Statistics. Go straight to the EpiQMS, which is now the EDI system that makes it more user-friendly. And you can get population data for your county and for your outreach. When it came to the level of detail that we needed to know to empower an individual to protect themselves from cancer, the data were limited. The number of cases that were collected either through observation or through survey methodology allowed us to have an NA in every cell that was populated for Latinos and Hispanic. Number one, they were underrepresented in that particular data inquiry. Number two, they had less than 10 cases, which will make it statistically unreliable, or basically they just didn't want to speak and answer any questions when they were approached. My experience with the Hispanic community and teaming up with you has been very effective. We have had a 100% response rate for individuals that are willing to learn about cancer risk. In participation, we have exceeded the 35% of participation for Latino recruitment and retention in clinical trials. Our response rate is 80% and higher. In some communities, we have 100%. And it's not so much because it's a Latina addressing a Latina issue, or that maybe we are going into these vulnerable populations that are historically identified as medically underserved, and that the response may have been better because there's someone there that said help is on their way. But the same response rate of enthusiasm to prevent cancer in the Commonwealth was also seen in our urban settings and in our affluent communities as well. So what does that mean? That means that cancer can be addressed, that cancer can be prevented, it can be treated, and most importantly, it can be controlled with the right tools, the right legislators and the right legislation, the right advocacy, the right funding, and more importantly, the right dissemination of these findings. So ladies and gentlemen, again, my name is Oralia Garcia Dominic, and I'd like to thank you, our community, as well as the press here present, as well as the state capitol for allowing this release to take place in its home base. I'd also like to thank you for being part of the first ever Latino Cancer Burden Report. I'd like to thank the Pennsylvania leaders, everything from our governor's office to the Department of Health leadership, to his cabinet members, and more importantly, to the legislators that champion not just the talk about addressing cancer, but as Senator Teplet said, when my name was put forth to serve on a cancer advisory board, which are only 11 individuals in the Commonwealth of over 12.6 million individuals, to say, you can serve. I did my part to nominate you, but it is the Senate's job to confirm you. And it is senators like Senator Teplet that said, I know many say you are a Republican. I am a Democrat. Many say you are a Democrat, and many say you're a Republican. He says, to me, cancer is bipartisan. To me, the people in the Commonwealth matter, and one cancer death is one too many. I will champion for you. And I'm happy to report that I was able to be confirmed, and I want to say it was unanimously, if I'm not mistaken. So thank you. I share that with you because to talk about cancer is one thing, but to really put your boots on and champion for it, the workers are few, and the work is plentiful, as you know. I want to thank the mayor's office, because as you notice, we have different levels, from the national levels with our partnerships in funding, to our state level through our governor and cabinet members, to our Department of Health and through our CAB representatives that partner and are part of the institution on the front lines for cancer. Our physician general, I'd also like to extend my thank you for their advocacy in her office. I also want to thank the individuals that serve on the Cancer Advisory Board. They also have a committee that's called the Data Advisory Committee. And these individuals that are embodied of members that are representatives of other areas within the Department of Health for Health Statistics to tells you how bad is the disease, do we even have a problem, and if so, at what level, and for whom and where. They are called the DAC, and I'm also very appreciative because those data were my baseline for understanding what the current state of the disease for cancer is here for the state. I'd like to now just give you some facts about cancer, and as it pertains to Latinos and as it pertains to Pennsylvania. Cancer is the second leading cause of death in Pennsylvania. It's exceeded only by heart disease. 5 years ago, in 2011, we looked at data, and we quickly understood that there were 77 people that had diagnosis of an invasive cancer, and approximately 28,000 of them died of cancer. I also want to bring to your attention that there are new diagnoses of cancer each year, and that this cancer is not just a blood value, but it is a diagnosis that impacts the individual, their family, their emotional status, as well as their financial burdens on cancer patients and their families and their advocates. According to the Center for Disease Control, it costs a lot to treat cancer. Over $7.3 billion in medical costs and lost in productivity, and these estimates have been at least a decade. I also want to acknowledge that we have new policy that says that we have now more access to care through the Affordable Care Act. I am not here to speak about the Affordable Care Act other from the aspect of cancer prevention. Please check your policies to see if indeed you have something that is called preventive services. Because for the first time in the history of this nation, you're able to get screened for colorectal cancer, for breast cancer, and for other cancers at no cost. Again, you must look at your own policy, but it is my understanding if the Affordable Care Act is executed as it's written by law, that you will now have access to have these type of preventive services, and most of them, if not all, by no cost. How many individuals have asked me, can you prevent cancer? The answer is yes. Okay, how much? Depends on the cancer subtype. Up to 95% of a cancer can be prevented, other subtypes up to 30%. But we are all in agreement that at least 1 in 3 cancers can be prevented. How do you do that? The science is strong, our data is strong. By not using tobacco, by having a healthy diet, being physically active, and moderating the use of alcohol. Nothing is more disappointing than a late-stage diagnosis. For many of these cancers, Latinos have the lower incidence, including colorectal cancer. That means they're the least group to get it. But when it comes to late-stage diagnosis, they're on the front line. And can late-stage diagnosis be prevented? Absolutely. It's called early. An early-stage diagnosis means that you saw your doctor, that you were able to talk with your doctor about lowering risks, and more importantly, to follow the screening guideline that is age-specific and sex-specific for your particular needs. These are guidelines that are respected in every clinic, in every state, and in our nation. We'd also know that screening increases the chances of detecting something early. The earlier it is detected, the more likely it is to be treatable and the easier to treat. In terms of distribution, I would like to say, or distribution of a diagnosis, I'd like to say that approximately half of all cancers are diagnosed at the early stage, but we are missing the other half. If those numbers apply to Latinos, it is up to about 75% of Latinos that can benefit from early stage diagnoses. We also know that there's cancer mortality. Again, about 28 to 35,000 individuals in Pennsylvania dying of cancer. For geographic information, we also know that there are differences for incidence by male and female. And again, where you live does matter. We started our career identifying the genetic code to prevent cancer. Today, in 2016, here in the Commonwealth of Pennsylvania, I'd like to announce, if you haven't heard it already, that your zip code is also just as important as your genetic code. And that does make a difference in terms of the social determinants of health and how to prevent yourself from cancer. Urban and rural areas, again, are of priority. And if you combine both, that means that the entire 67 counties are of a priority. In terms of what you use and where and how and which type of strategic and metric-driven strategies that are cost-effective, a good return on investment per se, and more importantly, that can save lives, are person-specific, neighborhood-specific, cancer-specific, and strategy-specific, and those are outlined in the report. The primary goal of the Cancer Burden Report is to provide information about cancer, and we emphasized on cancer risk so that you can start addressing the risk, because risk factors can then be used as a conversation as opposed to just prevalence for the entire state. Again, the Burden Report was funded by the National Institutes of Health. It was compiled by 3 individuals, 2 health disparity experts, Dr. Jean Langridge and Dr. Aurelia Dominic, and a statistician, Mr. Jerry Miller, who is an expert in health data as well as in burden reports and helping us put these together. Dr. Langridge brings an expertise, not just a cancer expert, but also as an epidemiologist, as well as a geospatial and mapping expert that creates so many of the devices that are used to single out clusters of cancers throughout the Commonwealth and in the nation. Findings. What does this mean when it's all said and done? In the report, you find relative risks, not just by sex, but also by county, and for every cancer subtype. Dr. Langridge highlighted three of the priorities that are probably at every discussion table at every level. He mentioned colorectal cancer. He mentioned breast cancer. And he also mentioned some other cancers that had to do maybe with pancreatic cancer. In the report, you will find every cancer subtype. You will also find the stage of that particular cancer and the site, a primary site versus a secondary site, for males and for females. And you'll also see in the report aggregated counties or sub-regions in the event that your particular outreach has more than one county or has a particular service area. So what did we find? We found that there are significantly higher relative risks seen in the Latino population compared to non-Latino. And I want to highlight that we did have a comparison group, and we did address the 12.6 million individuals that represent the Commonwealth. The burden report is inclusive, but there are 2 categories of comparison: Latino group versus non-Latino group. It also allows you to have social determinants of health addressed so that you can then look at level of income. You can also look at the type of industries and work placement by county. You could also go back as far as to 2002, and you can have a settlement pattern. What was your population for Latinos in X county in 2002? And we do that by year to the most present year, which is the 2013 data, which is the most advanced data that we have. Data 14, 15, and the year 16 is being collected. 14 and 15 is being data entered as well as analyzed. In terms of the types, bottom line, when it comes to Latino, what are the cancers of priority that we saw time and time again among all counties? Number 1, breast cancer. Number 2, prostate cancer. Number 3, colorectal cancer. And number 4, non-Hodgkin's lymphoma. These were the primary cancer types that were diagnosed in the Latino community. These trends continue again from 2002 to 2013. And what percent of all cancer types do these represent? 50% of all cancers that are seen in the Latino. I'd like to highlight a new cancer. Not a new cancer in terms of its diagnosis and what we know to prevent it, but a new cancer that must be addressed in the Latino community as well as anyone else that may have average or an increased risk of obesity or diabetes. One of them the cancer is liver cancer. Liver cancer is now a public health concern based on our report findings. I'm hoping that liver cancer becomes a priority agenda so that others can start addressing that. And liver cancer in the past or traditionally has been associated with alcoholism or excessive alcohol use. But we now also have what we call liver that is non-alcoholic fatty liver, and that is again due to obesity and lifestyle modifications. So liver cancer is also now on the radar, in addition to prostate, in addition to colorectal cancer, in addition to breast cancer and non-Hodgkin's lymphoma. How do you have access to the report? The report is absolutely free. Again, it was sponsored by NIH, which is a federal agency with tax dollars. The report belongs to you. There are no logos on the report. It has just the 3 authors. You are free to use the report to help inform your efforts. The report is 142 pages, again, inclusive of all counties, all subtypes, by sex, by race, ethnicity, as well as by the social determinants of health. It is graciously housed at no cost at the Appalachia Community Cancer Network. The website has been provided in both the publication. It will also be provided to you directly. You click on the link and you can download the report. You are welcome to share the report with anyone among your teams, as well as others that you feel. And should you extract certain pages, we just ask you to give the proper citation to see who would be held accountable for the reporting of these data, which again would fall to accountability for the report. I'm hopeful that you find this information very useful, and of course in your planning efforts and necessary to address cancer in Latinos. Again, we like to make a contribution to the Commonwealth. We like to put the wealth back in the Commonwealth. And one tool that we decided that would be very rich in nature is to know what is cancer doing in the Commonwealth for the levels that I have described to you. I'm also hopeful that the Cancer Burden Report in Pennsylvania will help inform efforts at your level, as well as at the governor's level, at state level, and then that Pennsylvania becomes the model for other nations, or other states and nations to follow, both now and in the future. In closing, I'd like to just talk about the final question is, can it be prevented? As I mentioned to you, yes, it can. Can all cancers? Some, depending on the stage and depending on the sub-cancer type, may be very difficult or more difficult than others. But for the common ones that we see, help is on its way. And good news is on its way because we can address it. Again, 1 in 3 cancers can. And depending colorectal cancer, if you remove a polyp before it becomes cancerous, you can literally cure colorectal cancer. Cancer cannot grow without a polyp. Colonoscopies remove polyps. We also have other screening tests that are now take-home. So that particular cancer has a lot of advancement. In terms of prevention, we do know that there is a workforce shortage, both in healthcare as well as in education. And the workforce shortage makes a difference because if you enter, for Latinos in particular, and really for anyone, if you enter practice or a clinic and you feel disrespected, or you feel that you just really weren't heard or understood, then modern science and burden reports can only take you so far. The doctor-patient communication makes a difference. And I'd like to conclude my session in 3 summaries. Number 1, we have data now that can help inform your efforts. It's called the Latino Hispanic Cancer Burden Report in Pennsylvania for 2016. And we thank you for being here for the release of that. My second summary is that help is on its way, and we have help. We have legislators, Senator Teplitz, thank you so much. We have Department of Health, Sharon and David, and our entire staff in the Department of Health. Thank you, because you allow researchers like myself better understand how and what cancer is doing in our city. Another summary, just quickly, thank you, Dr. Langridge, for teaming up with me, and Gerald as well, so that we can produce the report. It took us 2.5 years, half a year to design it, and another 2.5 years to put this together to be as inclusive as it can. So this work was very thorough, and it was very inclusive. And I also want to thank Dr. Cambick, because when we are in the community offering screenings, we need workforce shortage to be addressed. And we also need a doctor that is culturally competent and culturally sensitive. And 90% of all my referrals for cancer prevention and treatment, meaning that anyone that came with to get screened and had a positive outcome were either with Janine Peterson at the federally qualified centers, at Penn State Cancer Institute, or at a private primary care physician that teamed up with us, and that is Dr. Cambeck. And Dr. Cambeck has also addressed the workforce shortage by hiring individuals of diverse background in his clinic. So I will again yield to you, for you made this report possible. I thank you for the legislation and the leaders that allow the advocacy, the policy, and the endorsement of such efforts. And then lastly, I also thank Joyce Davis for not just allowing cancer to be addressed in the Commonwealth, but worldwide through the World Affairs Council of Harrisburg. And Dr. Cambeck, just in summary, as a physician, will you please join me and just say a couple of words as to from a provider's perspective of cancer preventions. Again, thank you everyone for being here, and I will conclude and allow Dr. Cambeck to just say a few words in our cancer efforts.
Thank you for having me today. I'm born and raised here in Steelton, practicing there 32 years in private practice. I'm extremely fortunate to add Dr. Gina Charles, who's joining us, and if I told my residents once, I've told them 1,000 times, my next life I'm learning Spanish, because it is a real problem with communication. But fortunately, I have somebody who's completely fluent, so I'm good to go. Communication is the issue that is constantly, and education is constantly needs to be addressed with our minorities. I'm happy that the legislations have changed and make it easier for us to get these screening tests done. The Affordable Care Act, one of the good things out of it is that screening tests, if they're coded as screening tests, are outside patients' deductibles. People will come in, they can be here for a cold or a sore throat, and we say, hey, by the way, when was your last mammogram? When was your last pap smear? When was your last colonoscopy or colorectal screen? And immediately the patient goes, Doc, I have a $3,000 deductible. I can't afford this. And I'm like, you can't afford not to have it done. Tragically, I had a 73-year-old female that was referred to me for colorectal screening with rectal bleeding. 73-year-old female, 3 weeks ago. We scoped her, and she's going to end up with a colostomy bag because she waited too long. The take-home message is you can't wait till you see blood on the toilet paper to get help. Screening starts at age 50 or 10 years younger than your family person having a problem, and so therefore this is what take-home messages have to be made to the inner city. It should not be an insurance issue anymore with these changes. You mentioned recently the big increase in liver cancer. You know that 20% of hepatitis C cases that go into chronic hepatitis C turn into liver cancer. We have to thank the legislators because they just approved that in less than 2 weeks, we are now obligated to inform every patient we see born from 1945 to 1965 that they are entitled or need to have hepatitis C screening. I believe the last statistics I read, we're the third highest state in the country with hepatitis C cases, and most of them, by far, are walking around on our streets and don't even know they have it. So this will be another thing that will be discussed to people if you come in just with a cold and sore throat. When I first went into practice eons ago, I had hair back then, I could run up these steps without being short of breath. Breast cancer was the scourge. Oh my God, everybody was going to get breast cancer, and that was it. 1 out of 8.5 women in our state were getting breast cancer. Just because of the emphasis and the communications and the legislative changes and the prevention and early detection, look what we have now. If you had to have breast cancer, breast is the one to have. You got the entire NFL going to wear pink this month for breast cancer awareness. We need that for prostate. We need that for colon also. So I'm just happy which way it's going. It's never fast enough for me, but at least it's all going in the right direction, and I'm happy to contribute any way I can, even as a private physician. Lastly, I am the program director of the family medicine program at Pinnacle, and my residents will all tell you, and Gina's a product of our residency program, that we drive home prevention, prevention, prevention every day. Lots of legislative changes are made that there's core measures that we have to report on patients every day, no matter what we're seeing for them, with Medicare, Medicaid, and all the insurance programs. So the tide is turning. We just got to keep this ball rolling. Thank you for the opportunity.
Well, thank you very much. Now you have it. You have the information. You have the data you need. I want to remind you again, in La Voz Latina Central, Dr. Oralia actually has an article in here with links to where you can get the report. The World Affairs Council will have it on our website. The City of Harrisburg will have it on its website. And I will vow to Dr. Oralia that we will do a forum so that people can come together, ask questions, and get more information directly from the authors. So be prepared that we will give the call to action for that forum very soon. So with that, I want to thank them. And do you... What? You want to come up? I want to thank the authors, thank Dr. Teplitz, thank Dr. Dr. Eric? Cambick, that's right, Dr. Cambick. Everyone who's been involved with this study, it would be great to have you here so that the audience here, that everyone can really give you their thanks for doing this, for supporting this, and now we're charged with getting the word out. Thank you all.